What's a herniated disc? You've all heard about that. You've heard them called slip disc and ruptured disc, the herniated disc. They're associated with pinched nerves. But the discs are the shock absorbers, the spacers in between the vertebrae from your neck all the way down to your lumbar spine. There's 33 of them. Any of them can wear out, break down, break, and then part of it pop out. That's the herniated or ruptured disc. Now that happens over time or can happen right away with some severe trauma, but most of us it's an age-related thing. What happens is the outer covering, which is fibrous, breaks down and allows the soft center to work its way out. If it just starts to work out, then the disc bulges. And if there's a break in the outer covering, a piece of that center of the disc, we call it the nucleus pulposus, that can pop out, and that can put a lot of pressure on the surrounding nerves in the spine. Some of the chemicals from the degenerating disc can also leak out, and they can be very irritating too. So that causes local pain, like in the back or the neck, and that can also pinch a nerve and cause pain that shoots or radiates down the arm or down a leg. Luckily, most people with a herniated disc don't need surgery. Over about 6 weeks, their condition improves with time, with some medication. You may need some special attention, like a steroid shot or some physical therapy, but most people recover. About 5 or 10% don't, and then they seek out the help of a surgeon to consider if there's a surgical solution for that. So after about 6 weeks, if the condition isn't improving and someone is suffering, then we consider surgical intervention for a herniated disc and usually a pinched nerve. At the Bonati Spine Institute, we put in a small tube either in the neck or in the low back. Through that small tube, do the surgery that's necessary to remove the piece of disc that's causing the pinch or the problem. It's done under local anesthetic. It's done on an outpatient basis, and it's very successful.